All right, here we go. Hello, everyone, and thank you for attending this program on HIPAA Made Simple. There's no audio taping or videotaping allowed, in any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information in this presentation is for educational purposes. Target coding is not a law firm. We don't provide legal services. CPT is a registered trademark of the AMA. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotler. I am a chiropractor. I practiced for 16 years, and about 12 years ago, I started a company called Target Coding. I'm the president of the company. I'm also certified in CPT coding. I'm a certified professional compliance officer. My areas of expertise include Medicare compliance, HIPAA compliance, CPT and ICD-10 coding, chiropractic record keeping, treatment plans, and how to create compliant cash plans. I've written many training manuals and books on chiropractic billing, coding, and documentation. Write articles for Chiropractic Economics, Dynamic Chiropractic, the American Chiropractor, for many other state association newsletters and journals throughout the country, and I'm a guest speaker at many state association conventions throughout the country. Those of you listening to this presentation, if you're part of your state association that's looking for a speaker on coding and compliance, let us know. We may be able to work something out. So let's go over the basics of HIPAA. HIPAA became a law on August 21st, 1996. So it's been around a while. It's been around over 20 years. It's just become very popular, and it's become implemented over the past couple of years because of all the cyber criminal activity that's going on and all the breaches that occur. And, nowadays you could have a disgruntled employee file a HIPAA complaint against you, or you could have a very unhappy patient file a HIPAA complaint against you, or you could just have an innocent breach occur. So these things are more common nowadays. So that's why HIPAA is being implemented now. It's being looked at much closely nowadays because of all that activity that's going on. So the main purpose of HIPAA is to protect patient health information. It's also known as PHI, Protected Health Information. I'm going to be mentioning that PHI term many times throughout to this presentation. Now, HIPAA applies to all covered entities. You may have heard that term. HIPAA applies to all covered entities. Now, are you a covered entity? Maybe, maybe not. Now, covered entities include healthcare providers like chiropractors, medical doctors, osteopaths, insurance companies, and clearinghouses. But you could be a healthcare provider that's not necessarily a covered entity. So, are you a covered entity? There's a couple of questions there's actually two questions that will help decide whether or not you're a covered entity or not. So, let me ask you the first question. Do you bill or receive payment from insurance companies? Most chiropractors do. So most chiropractors are considered covered entities. If you are considered a covered entity, then you must abide by all the HIPAA rules and laws. Now, if you do not bill or receive payment from insurance companies, then you're not a covered entity. Now, you have to answer no to both questions in order to be considered a non-covered entity. So, I could tell you this first question. Most chiropractors do bill and receive payment from insurance companies. That's why most chiropractors are considered covered entities. Next question. Do you submit claims electronically? Is there transmission of patient information over the internet occurring from your practice? If the answer is yes, you're a covered entity. If you answer yes to any of these, you are a covered entity. If you don't think you're a covered entity, you have to answer no to both. So the first question was, do you bill, receive payment from insurance companies? If you answer no, okay. Next, do you submit claims electronically? If the answer is no, then you are not a covered entity. But I could tell you most chiropractors are, because most chiropractors do bill and receive payment from insurance companies, and most do deal with some electronic claim submission. Now, I do get these types of responses when I do my seminars throughout the country. Dr. Kotler, I'm an all-cash practice. I don't have to be HIPAA compliant, do I? Or I have a billing company. They do everything. I don't really get involved with it. I give them the information, and the billing company does all the billing. Okay. Everything is in the cloud. I mean, these are some of the things that you might be saying to yourself. Do I have to abide by HIPAA or not? I could tell you again, most do have to, because of those two questions. But you could say, my practice is mostly personal injury, or I don't even have a computer. Believe it or not, I do have a couple of doctors that I work with. They do not have a computer. Everything's paper. I have some doctors, they go, well, I use handwritten notes and forms. Do I have to abide by HIPAA? Or, Dr. Kotler, I don't have any employees. I'm a sole practitioner. I don't have any employees. Do I have to abide by HIPAA? So these are all the questions you may be asking yourself as to whether or not you have to abide by HIPAA. Again, most doctors are required to abide by HIPAA. Now, another thing that you may be saying, well, Dr. Kotler, I think I'm HIPAA compliant. I have patients come in, they sign the HIPAA forms. I'm using a certified software company. Does that mean I'm HIPAA compliant? Absolutely not. You're on your way. You're doing a few things that would entail being HIPAA compliant, but just having patients sign that HIPAA Notice of Privacy Practices, you may use a software company that's HIPAA compliant. The software company is. That doesn't mean you are. You may speak quietly in your open adjusting rooms. Again, that's part of HIPAA, but that doesn't necessarily mean that you are HIPAA compliant. So can you opt out of HIPAA? Well, if you do not submit claims electronically and you're not getting paid by insurance companies, then yeah, maybe. But most chiropractors are covered entities. HIPAA is mandatory. It's not a suggestion. Now, you may not have to implement a formal HIPAA program if you feel like, well, I don't submit electronically, I don't, do those things, but your state requirements may be stricter than the federal. So you're better off safe than sorry. I look at HIPAA like homeowners insurance, and I know some people in Florida that did not have homeowners insurance, and a hurricane came through Florida. And these, people, they said that they want to save the $5,000 every year. That's what their homeowner's insurance bill was, about $5,000 a year, and they didn't want to pay it. Well, boy, are they sorry now because of the damage that has occurred due to the hurricane. So to me, HIPAA is like buying homeowners insurance. You'll definitely feel better knowing that you have it in case of an emergency. So let's assume that most of you listening to this are covered entities. If you don't think you are, contact us and we'll go through the checklist, and we may be able to create a program for you, sort of like a HIPAA Lite program. Now, business associates. You may have heard this term, business associates. Examples of business associates are billing companies, software companies, clearinghouses, attorneys in certain situations, not a typical PI attorney asking for records. Your IT person, you may have a patient, a friend, a neighbor, a relative. That's your IT person that sets up your Wi-Fi and your network. That's an example of a business associate. If these individuals or companies have access to your patient PHI, they're considered business associates. Collection agencies, transcription services, cloud service vendors. You may have independent contractors accessing your system from an outside location to do billing or something like that. So a business associate is basically a person or a company that's not an employee of your practice, but can access your patient protected health information. So if that is the case, if you do have a billing company that's accessing your patient information, then you would have to have them sign a business associate agreement. You need to have those in place. Those are mandatory. Again, having these things in place, you're better off safe than sorry, because I get questions from doctors all the time. Well, I have a cleaning service that comes in, or I have a staff member that does this or does that. They're not, they're not an employee. They're an independent contractor. My recommendation is give them a business associate agreement to sign. Better off safe than sorry. One of those just in case situations. Now let's talk about social media and HIPAA. Where's the relationship there? So with social media, the patient protected health information, the PHI, needs to be protected even on social media platforms. Now, if a patient wants to go on Facebook or on social media and say, hey, I went to Dr. Kotler. He's the best chiropractor I've ever been to. I was suffering with neck and back pain for years. I went to Dr. Kotler, and he helped me tremendously. I recommend everybody go to him. A patient could go on a social media platform and do that, but you as the provider, without authorization, cannot do that. So I don't recommend having conversations on social media platforms regarding PHI without the patient's written authorization. I'm going to show you an example of a written authorization. I'm going to provide that to you a little bit later when I give you some sample forms. I don't recommend you post selfies on social media platforms without patient's written authorization. Breach violations can occur easily and inadvertently. I don't recommend staff members friend patients on social media. So be careful, because there's a lot of stuff that can go on in social media. And sometimes, patients could, use it as leverage. I was working with a doctor recently who had an unhappy patient. What happened was this doctor charges $350 for his examination. He tells the patient up front, my fee is $350. That's a lot of money. It's more than the average. I had him create a form that patients understand on their very first visit that that's the cost, and they agree to pay it, and patients sign the form, and it works most of the time. Well, one patient was not happy. The patient came in, paid the $350, and then the next day said, I think this was unfair. I think you overcharged me. I want my money back. So the patient is now saying they want their money back. And the doctor says, I'm not giving you your money back because the doctor didn't do anything wrong, right? So the patient then went ahead and said, if you don't give me my money back, I'm going to blast you on social media. So it's important to take these things seriously and don't respond without letting things marinate for 24 hours. Ultimately, he had to give the patient the money back because of a few situations that it was just escalating, and it was just easier just to give the patient the money back, which was totally unfair, on behalf of the patient to do this. But in order to, prevent this situation from escalating, the doctor ended up giving the patient the money back. But, that's patients can use that as a threat to go on social media. So I wouldn't blast patients on social media, So here's a interesting situation. Thought I'd share this with you. Did ESPN violate HIPAA? A couple of years ago, a very well-known football player named Jason Pierre-Paul plays for the New York Football Giants. He was playing around with fireworks, and he had some damage to his hand. So he went to the hospital, and he had to have some surgery. His right index finger had to be amputated. Well, somehow, some way, an employee of the hospital gave the information to ESPN. ESPN then posted the hospital record online. There's a picture right there on your screen where it actually has the patient's name, his age, his account number, what was done. There's a lot of important information in there. That is PHI. That is protected health information. So this was posted online by ESPN. So did ESPN violate HIPAA? The answer is No. Why? Because ESPN is not a covered entity. Remember, a covered entity is a healthcare provider, like a doctor, a hospital, chiropractor, medical doctor, physical therapist, or an insurance company or a clearinghouse. So ESPN didn't violate HIPAA, but Jason Pierre-Paul could have some problems with ESPN. Jason Pierre-Paul could sue the hospital. Did the hospital violate HIPAA? Yes, the hospital did violate HIPAA, so HIPAA could fine the hospital. So just a little tidbit on how social media relates to HIPAA. Now let me share with you a few forms that should be used. First one is the HIPAA Notice form, or the Notice of Privacy Practices. This is a mandatory form that you should give every new patient, and it has a lot of good information on it. Now, this form, if you have one, make sure that the effective date is after September 2013, or make sure you have the updated one from September 2013. That's when the HIPAA notice got a big facelift. Major things occurred in September 2013 relating to HIPAA called the Omnibus Rule. So there was a major overhaul, and one of the things that got updated was the Notice of Privacy Practices. So make sure you have the most updated one. If you would like, we can send you a copy of ours, the one you see on your screen. Just send an email to Natasha@targetcoding.com. She could send you a sample of this form, and there's some really important information in here. Now, make sure you have an updated one. Make sure, like I was working with a doctor right now. Recently, he sent me his HIPAA notice to review, and that's part of what we do as a consulting company. We'll review your forms, your intake forms, your new patient questionnaires, your HIPAA forms, your release of information forms, your financial policy forms. That's part of our consulting service. So I was reviewing a doctor's HIPAA notice, and I realized that there was dental information in it. And I asked the doctor, what is this? He got the HIPAA notice from his brother-in-law, who's a dentist, and he just took his brother-in-law's dentist and he's using it in his chiropractic practice. Come on. You got to read these forms, make sure you know what's in them. There's a lot of important information in here. One thing that's important here is a patient could say, I want to pay you in full for the service at the time the service is rendered, in full, out of pocket, and I don't want you to bill my insurance company. So that's a patient's right. Patients have rights. They could ask you to correct their record. They could ask to request confidential information. For example, Mrs. Jones comes in. She says to your front desk assistant, if you have to call me to remind me of an appointment, don't call me at home. Don't call me at my office. I don't even want my husband to know I'm coming in here. I don't want anybody to know. I don't want anybody at my office to know I'm coming in here. I want to keep this private. Just call me on my cell phone. So now you have a new CA that calls the patient at home and leaves a message. Hey, Mrs. Jones, just want to remind you about your chiropractic appointment. And now the patient's husband hears it. And now the patient comes in fuming. And hopefully the patient won't file a HIPAA complaint against you, but that's one example of how you can get a patient to get very upset. So they could ask for a copy of the notice. You have to supply them with the information if they feel like their rights were violated, where to call or send an email or write a letter. You have to give them the address. And then there's information that you are explaining to patients on how you're going to release their information, use their information, how you're going to share their information, what your responsibilities are. This form needs to have the compliance officer's name, email, and the effective date of the notice on the form. And then the patient has to sign the form. Sign a form stating that they had the opportunity to review your HIPAA notice. You don't have to give them a copy. What my clients do is they laminate the 3-page HIPAA notice, and then it's at the front desk, and every patient is handed the HIPAA notice. That's what most of my clients do, or it's posted in their waiting room. Every patient has the opportunity to review it. Most patients don't read it, right? I mean, most patients glance through it really quick. It's like, have you ever rented a car and they hand you that rental agreement? It's like 12 pages. Most people don't read it. They just sign the bottom. I think that's what most patients do when you give them the HIPAA notice. They don't really read it. They just sign the form. So here's the sample form, and it says we're required to offer you a copy. Our HIPAA notice and policies contain information regarding payment, health insurance, collection, and other important information. The patient has an acknowledgement there. I acknowledge and agree to the HIPAA notice. I have reviewed the HIPAA notice. I may refuse to sign it if I wish. Most patients will sign it. If for some reason the patient doesn't want to sign it, then a staff member should fill out the bottom of the form. Next form is a photograph, video, and written testimonial consent and release form. So if you have a patient that wants to give you a testimonial, whenever I walked into the room and the patient said, Dr. Kotler, man, am I happy I'm a patient here. I should have come sooner. I've been suffering from back pain and headaches and these problems for years, and I come here and now I'm better. Those are the types of patients that I want to get a testimonial out of that person. I want to be able to use that testimonial on my website, in written materials, maybe in a company brochure, but I need to get the patient to sign a release on it. You know, I have some clients that take care of very, very well-known famous people. I have some clients that treat some very famous sports stars. So, you know, if you had a very well-known, if you had the star quarterback of your, let's say you lived in, Green Bay, and, Aaron Rodgers was your patient, the star quarterback for the Green Bay Packers, you'd probably want everybody to know, and you'd love to get Aaron Rodgers to give you a testimonial. Well, sure. Just have him sign the form that you see on your screen, and then go ahead and put his full face photo, his testimonial, on your website, on your Facebook page. So this is a very important form. And then there's also when a staff person resigns or you terminate an employee, HIPAA law says you have to have a termination policy. What are you going to do if somebody quits or you let them go? And there are certain things that you need to do, and it has to be in writing. You know, many of the things like, I'll ask doctors, do you have firewalls? Do you have antivirus software? Does your staff change their passwords? You change it every 3 or 6 months. Most doctors will say, yeah, I have that. But that's not enough. It has to be in writing, and a policy needs to be created for it. So one of the mandatory policies is a termination policy. And, these HIPAA laws and rules, although, to me, it's a pain in the butt to do this. This isn't something that you look forward to doing. It's just like you're driving on the highway and now you're sitting in traffic. Man, it's not something you look forward to. It's just part of driving. So part of running a practice is having to implement these policies and procedures, not because you want to, it's because it's a law and you are required to. And when you are required to do this, what I could tell you, what most of my clients tell me that go through our HIPAA program is that they discover things that, will help their practice improve. By having this policy in place, and then you have a problem down the road, it could prevent you from having some major issues. So just some of the key points here. Start with a security risk assessment. When it comes to HIPAA, that's mandatory. You have to do a security risk assessment. If you're not even sure what that is, many doctors I speak to and staff members, they go, what is that? If you're not sure what that is, send an email to Natasha at targetcoding.com. She'll explain it to you. She'll give you a demo. She'll take you through our HIPAA program, no charge, just so you could see what it's about. So start with a security risk assessment. Have somebody designated as your compliance officer for the practice. If a staff member doesn't want to do it, the doctor will name him or herself. You have to have written policies and procedures. Identify your business associates and make sure your business associate agreements are in place. Have formal trainings and log those trainings in a procedure manual. Now, here's a question I often get. Dr. Kotler, I've heard about Medicare compliance. What's the difference between HIPAA compliance and Medicare compliance? Well, they're two totally different things. As I mentioned, the main purpose of HIPAA is to protect patient health information. Well, the main purpose of Medicare compliance is to prevent billing and coding errors. It's also known as OIG compliance, Office of Inspector General compliance. So if you see Medicare patients, it's also mandatory here that you have a Medicare compliance policy and procedure manual. So how can you provide proof that you make formal efforts to prevent billing and coding errors, also known as fraud and abuse? You know, again, if I were to ask you, how do you prevent billing and coding errors? You might say, well, Marty, we send our staff to seminars. We have trainings in the office. That's terrific. Do you write it down? Do you have it in a formal log? That's how you can provide proof. So a Medicare OIG policy and procedure manual can provide the proof. And Medicare policies and procedures, I thought I'd just show you a couple of examples here. So again, if you see Medicare, Medicaid, any federally funded patient requires you to have a Medicare policy and procedure manual. And one of the policies or mandatory requirements is to do an internal review of your records. They call it internal auditing and monitoring, but it's basically taking out a couple of Medicare charts, looking at them, and doing a self-review. And we have this chart audit tool that we've created. It's basically a checklist. You do that a couple of times a year, and that helps you sleep better at night. That's the goal. You want to sleep better at night. We call it SWAN. SWAN is an acronym for Sleep Well at Night. That's what these things do. And it's interesting, the clients that are using my HIPAA program are the most successful practices because they want to protect their practices. This is about protection. This is about prevention. Here's another thing that you're required to do, believe it or not. With Medicare, you have to put your name and everybody's name in the OIG exclusions list, the Medicare exclusions list, to see if that individual has been excluded from the Medicare program. You cannot treat Medicare patients if you've been excluded from the Medicare program. And this is not only for doctors, it's for staff members too, because there are schemes and major fraud situations that occur with the help of billing staff, office managers, and receptionists. So their names need to go into this OIG exclusion list. So here, a couple of quick questions. Can you opt out of HIPAA? If you're considered a covered entity, no, you cannot. Can you treat Medicare patients without being enrolled in the Medicare program? The answer is no. Can you collect cash from Medicare patients without billing Medicare? The answer is sure, yes. Patient comes in for maintenance. Medicare patient is receiving maintenance wellness care, and they check yes to option 2 on the ABN form. Beautiful. That's how you collect cash without billing Medicare. Can chiropractors opt out of Medicare? The answer is no. Chiropractors cannot opt out of Medicare. Opting out is a private contract that occurs between the doctor and the patient, and chiropractors are not on the list of providers that could opt out of Medicare. And if you wanted to learn more, here's an article that I recently wrote. This is in the American Chiropractor magazine, this month's issue. I have some nice information here on HIPAA. You may want to go find this online, or you may get a copy in the mail. Some additional information about HIPAA, and just a few closing comments. Please check with the carriers you bill prior to submitting claims to ensure that it's compliant. We can't guarantee that this information will guarantee payment from any insurance company or patient. Target coding is not responsible for changes that may occur. It's important to do your best to stay on top of any changes by attending seminars, webinars, joining your national and state professional associations. Before we get to questions, just want to let you know that Target Coding does offer HIPAA compliance programs for chiropractic and integrated practices. You get a HIPAA compliance manual. You get everything in the cloud also. You know, some of the doctors we work with, they want to go all green, no paper. Great. Your entire HIPAA program is online in the cloud. We have other doctors that say, I like hard copy. I like paper. I want my manual. I want to be able to touch it. So we offer that too. So what we do is, for all of our HIPAA clients, you get both. You get everything digital and you get everything hard copy. You get a comprehensive security risk analysis with detailed report and action plan. You get a cloud-based storage portal for all your policies and procedures. We offer about 20 training videos for your clinical and administrative staff members. You get HIPAA compliance testing with certificates of completion. We help you track your business associates. This program also includes a Medicare policy and procedure manual. You get HIPAA updates and articles and links. You get $100,000 of cyber liability insurance just in case there's a problem. You get 12 months of HIPAA technical support. So that's our HIPAA program. It's a concierge type program. It's not something that we just give you forms. If you want to just get a bunch of forms and do it on your own, go right ahead. Our research has shown that it takes about 50 to 100 hours to do it on your own. But if you have the time and you want to do it, go right ahead. Our program to implement takes about 10 to 15 hours, and you'll be all ready to go. We also offer a Medicare compliance manual with policies and procedures for chiropractic and integrated practices. And this is a comprehensive, customizable Medicare compliance manual. We provide Medicare policies and procedures personalized for your practice. You get chart audit tools, correction action plan guidance, sample training logs, show you how to do background checks, employee training forms. So let us know if you're interested in our Medicare compliance program. Now, we also have a book that we have for sale. It's our most popular product besides our consulting services. We also offer some training manuals and books. This is our bestseller. It's the book on the best chiropractic ICD-10 and CPT codes to improve reimbursement. Thousands of doctors across the country have this book, and we get great testimonials on it, how much it's helped doctors throughout the country. It's different than Chiro Code. It's different than a basic book. This is actually shows you how to do it. You know, there are reference books and other books out there. I think that this book is something that every chiropractic practice should have as part of their library, especially for staff members. So one thing that it does is it shows you how to pair your CPT codes. So if you're doing therapeutic exercises, what are the best diagnosis codes to use? Well, this book shows you how to do it. And then this book also shows you what are the diagnosis codes that will typically pay for the most visits, called long-term treatment diagnosis codes. So we give you those for the lower back and the cervical region, and then we have some of these quick guides or cheat sheets. This one is specifically for personal injury. And then we have some clinical information. I usually don't get too much into clinical because I'm the code geek. I'm the billing and coding expert, not so much the clinical guru, but I partnered with a couple of people that are experts in the field to put together a little clinical section. So, for example, a patient comes in with cervical brachial syndrome. That code is M51.3. What ortho, neuro, and chiro tests should be done? Let's say you're seeing a patient with sacroiliac joint pain or sacroiliac joint sprain or subluxation. What ortho, neuro, chiro test should be done? So in this example, cervical brachial, do some rights, Atson, check for myotomal weakness, look for forward head posture. And there's another section here of the book on frequently asked questions. So, I've been asked from thousands of doctors over the past 12 years, hundreds of questions. So I've put together a few, not hundreds. So for example, I Recently got a call, not recently, but well, when I was writing the book, doctor said, what's the difference between radiculitis, radiculopathy, and myelopathy? You know, this is a doctor in practice, 25 years. You would expect them to know, hey, not everybody knows everything. There are many things that some of you, even in your practice 25, 30 years, you may not know. You could be in practice 25, 30 years and not know the difference between myalgia, myositis, or myofasciitis. You could be in practice 50 years and not know the difference between a disc disorder and a disc displacement. You could be in practice 1 month and not know the difference between cervical brachial syndrome and cervical radiculitis. So there's a bunch of FAQs there. We also offer seminars. So at Target Coding, we offer a lot of different items here. We offer books, videos, HIPAA programs, compliance programs. We also offer memberships for our consulting services. We have a basic membership here. It's $99 a month, pay as you go. And then we have a gold membership consulting program. It's a 1-year program where you get a comprehensive review of your codes, your fees, your forms. This includes a Medicare compliance manual. You get monthly training for all the chiropractors and staff members. These are personalized for your practice. You get Q&A support. You're going to submit your questions any way you would like. Email, fax, you can call, and you'll get your questions answered within 24 to 48 hours, guaranteed. Access to all Target Coding webinars, live and recorded, and we do probably 4 to 8 webinars a month, so you could have access to those at any time. The member-only section of the website has a whole bunch of videos and e-newsletters. You get our forms and templates. You get training manuals. You get access to all of our seminars, plus news alerts and updates. So that's our gold membership. And we also have a platinum membership, which includes a full day of training at your office. I will come to your office, or one of my certified coders will come to your office and have a full day of training. So here's our contact information. Email is info@targetcoding.com. Website, targetcoding.com. Telephone number, 1-800-270-7044. I want to thank everybody for attending. I hope you learned a lot.